And former acting director of the CDC, Dr. Richard Besser, joins me now. Dr. Besser, thank you for coming on. What do you make of Susan Monarez refusing to step down and these other CD officials essentially resigning in protest?
Yeah, well, thanks, Diane. Coincidentally, I had a meeting with Dr. Monarez yesterday before this all broke, and I've reached out in the past to all of the CDC directors to offer my support and to look to see how we at the Robert Wood Johnson Foundation could work with them. And one of the things that I always want to know is whether the director has a line in the sand that they won't cross. And what she said to me is that, there were two lines. One is that she would never do anything that was illegal, and the other was that she would never do anything that flew in the face of science. And she was being asked to do both of those things. One in firing her leadership team, who are, incredibly talented public servants. She wouldn't do that since there was no cause to do that. And she refused to do blanket endorsements for ACIP or immunization recommendations that were not based in science. The loss of her as a director gives me great concern. She is a very principled scientist, a public servant, and having someone like that in that role gave me some hope that there could be pushback against some of the moves that Secretary Kennedy has been undertaken. But I don't want us to lose the fact that we also have the resignation of four incredibly talented leaders at the agency who felt that they could no longer do their jobs. The head of the immunization center, in his resignation letter, acknowledged that he was not consulted, his team was not consulted as the secretary was making recommendations around measles, around COVID vaccination. And so for the agency to look like it was providing support and endorsement for recommendations coming from Secretary Kennedy that are not based on evidence and science, it just could not be part of that. This is very concerning for the health and safety of people here in America.
So what does this shakeup mean for the future of the CDC?
That's a really good question. We had the world's #1 gold standard public health agency. It wasn't perfect. There was a lot that needed to improve there. But what we're seeing with the firing of hundreds of CDC employees, the loss of leadership, a secretary who not only doesn't turn to them for advice, but has, through his words, led to a situation in which the CDC has been vilified. The fact under his watch, we saw a gunman shoot hundreds of rounds into buildings at the campus that I once worked in. It is absolutely chilling, and I think that it's going to take the White House to step up and say, we believe that our nation needs to be ready for the next public health emergency, and this secretary is not doing that. It's going to take Congress stepping up and saying we have a role in terms of oversight in what the executive branch does. They have not been doing that. I was very pleased to see that Senator Cassidy is going to be doing some hearings in the removal or the resignation of these top leaders at CDC. These groups have to step up and say the health of people in America matters.
The FDA changes will significantly limit access to the COVID vaccine. The latest COVID vaccines were only approved for elderly people and for younger people if they have at least one underlying condition. What's your take on that, and what's the potential impact here?
Yeah, what we're seeing is a situation where, as a clinician, we're not going to be able to look to the CDC for the gold standard in terms of recommendations. I am a pediatrician. I'm a fellow of the American Academy of Pediatrics. I was really pleased to see that they came out with recommendations that differ from the CDC. And it's going to be confusing for patients to know what to do. I recommend that people talk to someone they trust, to their doctor, their nurse, their pharmacist, because CDC is not going to be the place that we can turn to. What you would have expected from FDA is that they would have approved this vaccine for all and the CDC would have recommended it for higher risk groups and it would have been available to others, that may not be the case anymore.
All right, former acting director of the CDC, Dr. Richard Besser. We appreciate your time today. As always, Dr. Besser, thank you.
My pleasure. Thank you.